I'm Candace and I'm doing the IV fluid and med skills video. I'm gonna do hand hygiene and put my gloves on. I have my primary tubing and my secondary tubing. Both are 15 drops per ml. I have my two fluids, my fluids and my antibiotics. I have my piggyback hanger and my alcohol swab. First, I'm going to start with my fluids. We have 150 mLs of fluid over 60 minutes for 15 drops per ml, which is 38 drops per minute. I checked the order and did the 6 rights of the patient, right med, right dose, right time, right route, and right documentation. We also have antibiotics, and for the antibiotics, it's 250 milligrams in 100 mLs, 100 mLs over 15 minutes times 15 drops per ml is 100 drops per minute. I double checked the order and made sure that it was correct. I double checked with the patient to ensure that there was no allergies, and there are none. So now I'm going to explain the primary tubing. We have the spike end, which is going to be inserted into the bag of fluid or medication. And then we have the drip chamber. This is where you are going to fill the fluid about halfway and ensure that you can see the drops, and you'll be able to count the drops there. Then we have the roller clamp, which allows you to control the flow rate of the drops more or less, or completely stop. Then further down the tubing, we have the Y site, and this is where you would be able to give an additional medication or connect a piggyback secondary line. And then lastly, we have the adapter end, and this is where you are going to connect this end to the patient's IV site. I will start by getting my fluids and then removing the end cap, taking the spike end and inserting it into the bag. Making sure it's all the way in there. I'm going to make sure that the roller clamp is all the way closed, so that way I have time to. Then on my piggyback hanger, I am going to make sure that this is at least 30 inches above the patient for the medication. I want to make sure that when I am starting IV fluids that there's no air in the line, so I'm going to open the line and allow fluid to start to flow. If fluid doesn't come out, you can squeeze this and let it fill up about halfway, and you want to ensure that the fluid goes all the way through, so no air bubbles. Then I'm going to hang this up. I will watch the drops for 1 minute to ensure that it is 38 drops for the 1 minute. And we'll count. 1. And counted for 1 minute. Then next I would connect that to my patient after cleaning the end. And then next is my antibiotics. And for the antibiotics, we did the 250 milligrams in 100 mLs. Verified that there are no allergies, and it's 100 drops per minute for the 15 minutes. I will connect the tubing. It's very similar for this tubing as for the first tube, the primary tubing. It has the spike end that also goes into the bag, and it has the drip chamber to watch the drops. Then it has the roller clamp, which is going to allow you to stop and start the medication, as well as the adapter site, which will, or adapter end, which is going to go in the Y site on the primary. Prior to, I'm gonna take the cap off, take this cap off. I will then connect the tubing carefully so it doesn't. And I already did the 6 rights of the patient, time, medication, route, dose, and documentation. Make sure that this is closed, and then it's filled halfway. When I do hang this, I want to make sure that it's 30 inches above the patient, and I want to make sure that this bag, the antibiotic piggyback bag, is above the primary bag. I'm gonna hang this on here. I'm gonna make sure that there's no air in the line. It is right. And then I'll take my alcohol swab, and I'm going to clean the Y port, or the Y site, to connect the secondary line, and then ensure that the flow rate is correct. Make sure that it's 100 drops per minute, and I'm going to count that, and I'll adjust the roller clamp to ensure that it's the right amount. After I've connected it to the patient, I'm going to double check the IV site, make sure that there's no redness, warmth, or swelling, any reactions. If it's the first time having the medication, then I would want to wait a little bit to ensure that there are no allergies to that medication. I would clean up my mess, throw away any supplies that I'm not using, and thank the patient for their time, and make sure that they're in a comfortable position, as well as ensuring that their call light is next to them. I will remove my gloves and wash my hands and leave the room. after I documented though.